Welcome back. Have you ever known a child who's talkative at home but becomes quiet in social settings? It could be a disorder called selective mutism. Dr. Lynn Lunceford is here this morning to talk about the disorder and how to deal with it. Welcome.
Thank you.
It sounds a little bit like shyness, but this is something more extreme.
Right, and in fact, some people dismiss it as an extreme case of shyness, but if it's not treated correctly and early, it can really progress to severe social anxiety that can impact a child's life dramatically.
Talk about what is selective mutism exactly. What are the signs and symptoms?
Well, it is a severe form of social anxiety. So what happens is when a child is in a social situation outside of their comfort zone and someone speaks to the child, they literally go into the flight or fight response. The adrenaline starts coursing and they freeze. You'll see a young child of 3, 4, or 5 when someone says, "Hi, Tommy, how old are you?" The child literally freezes up, will avoid eye contact, can't answer, but acts normally at home and speaks normally when they're in a comfortable situation.
It sounds a lot like maybe some autism type of disease where they don't speak. Is it confused with that?
It's confused with that particularly early on because it's not a very well-known disorder. And so teachers, when they see that frozen child who avoids eye contact and doesn't communicate, naturally will think of the autism spectrum. And so the children often get misdiagnosed. The treatment isn't appropriate for the anxiety. They get put in special classes, and it can really delay their ability to grow.
So is there something that can be done? Is this a very treatable condition?
It is. It's treated with something called social communication therapy. And what we're working on is systematic desensitization. In other words, you take the child from where they are very, very nervous and anxious and help them grow one step at a time in their ability to communicate. You don't focus on talking, because if you focus on talking, it's like if you had a severe fear of flying and I said to you, "But Sandra, just come on, just come fly with me. We'll go to Vegas, we'll have fun." The more I tried to push you in that direction, the more anxious you would get and the less likely that you could go with me.
So you have to kind of ease into it and get them more comfortable.
That's right. You have to build that comfort level in every situation. So we often encourage parents to, for instance, do play dates with one child at a time until the selectively mute child can feel comfortable with that child in the classroom, and then you can add a second child in. But you have to really ease the child up.
Well, we have a tip board with some of the things that can help parents help their children, and you talk about working with the child and educating other people about this problem.
That's right. Because there's so little known about it, that's why it often gets misdiagnosed or overlooked entirely as just the quiet child. If the child's not acting out in school, then we don't give them as much attention as the child who's hitting other children and needs more attention.
Also, know how and where the child communicates.
Right. If you don't know that, then you can't build them up on the next level. So if a child isn't able to do anything in school, for example, then asking them to raise their hand to ask to go to the bathroom is too much. So they'll often do things like soil themselves in class, or if they're sick, they can't ask to go to the nurse because they're literally frozen. So we make things like little boards that they can point to what they need. You help them move up to the very next level of communication.
Is this something that happens at a young age, or can it develop when they're 6 or 7?
Usually it's noted from when the child is very young. They have kind of an inhibited temperament. Even as infants, parents will notice. And the first time it's really significantly noted is when the child goes to preschool, because that's usually when the teacher will note, boy, this child doesn't speak after the first month of class, when a lot of kids are normally shy, but after the first month, they tend to communicate pretty easily.
The other tips you talk about is having a child have a play date, one child at a time, and also building on your child's strengths. Is this something that's overcome strictly by kind of hands-off therapy, drug-free therapy, or are drugs part of the solution?
Drugs can definitely be part of the solution. Prozac is often used with children who have selective mutism if therapy by itself isn't successful, isn't helpful. Usually it's used with children who are a little bit older. So if the child hasn't been in therapy and the child is 12 or 13, the behavior, the avoidant behavior is really ingrained, and it's much, much more difficult to help that child kind of venture out of their comfort zone and try some new behaviors. So low dosages of Prozac have been found to be very helpful in letting the child be more comfortable and therefore try some of these behaviors.
Is this something that a child will outgrow, or is therapy or some sort of treatment always needed?
We don't believe that children outgrow it. They develop coping mechanisms at times, but I'm currently seeing an 18-year-old who doesn't speak to anybody but his family, and so he's homeschooled. He's really unable to function in the world because he's so debilitated by his mutism.
And the impact of that is so obvious.
Incredibly dramatic, and he really doesn't function outside of his home environment.
Interesting topic. Dr. Lunceford, thank you for stopping by. We're going to have information on the KUSI website and where parents can go to get help.
Thank you.
Thanks for your time. All right, it is